Welcome everyone to Menopause Support Circle, and here we are with Dr. Vikram for the next episode on menopause awareness. Needless to say, he wears lots multiple hats. He's a specialist in reproductive health, women's reproductive health. He's a honorable assistant professor in London College, Medical College, and he practices with London Hospital. He also has his own practice and he contributes a lot in research with respect to this topic, especially women menopause. And I believe recently you got associated with the menopause policy as well. I just noticed it in the LinkedIn. A lot of things. And apart from all these things, despite his hectic schedule, he is doing this for us. He's so generous enough to come and educate us on this topic, menopause awareness. So I don't want it to take much of your time, but one thing disclaimer that this is not a consultation. This is purely for your information. Take it and use it for your menopause management. That's all. Over to you, Vikram.
Thank you. Thank you, Sharmila, for actually putting these sessions on. And thank you to everyone who's joined because you're giving up your weekend time. So hopefully you will get something out of today's session. And we were trying to think of what topic we should do today. And we thought we would just go through some of the basics. What is perimenopause? What is menopause? What happens if you have premature or early menopause? What is it? And also surgical menopause. People may have hysterectomy, they may have removal of ovaries or cancer treatments, and of course that can put them into sudden menopause. So we will try to have a bit of basics about all these topics. What are the changes that happen? What one can do in terms of lifestyle, medications, to protect the long-term health, to keep the quality of life. So I'll share some slides just to kickstart the topic, around 20-25 minutes of slides. And then, of course, we'll keep the floor open. So anybody who wants to share their experience or ask questions, more than welcome. You can switch on your camera or you can just put it in the chat and Sharmila will pick up the questions and I can answer them. So very informal, very easy session. And then we'll make a start with my slides. I'll share them first and we'll take it from there. So sharing my screen now. Okay, Sharmila, can you see my slides?
Yes.
Okay, thank you. So we'll make a start with what is perimenopause, menopause, premature menopause, surgical menopause, why it is being talked about so much now while we did not talk about it before, what are the implications, how can one make this transition easy for themselves. So how is perimenopause, menopause defined? We'll look at what are the symptoms and signs to look for, how is it confirmed, do we do any blood tests or any other tests if we need to think of any treatments, for example? What is surgical menopause? Why are we talking about it separately? What are the implications of menopause for fertility or long-term health? And how do we suppress the unpleasant symptoms that may affect some individuals during menopause transition? How do we protect the long-term health of individuals? So let's look at how the journey happens. So we know that before any hormonal changes happen around midlife, all the phase before that, let's say the first 4 decades of life for a woman is premenopause. So nothing has changed here. A woman would be having her periods, usually every month, every 4 to 5 weeks. And there are no hormonal changes, no changes that happen that will often be happening at menopause because the FSH will be normal, the LH will be normal, the estrogen, often the key female sex hormone, all of them will be in the normal range. They will be having cyclical pattern because every menstrual cycle they will go up and down, but there'll be no menopausal symptoms. The first phase that happens when menopause begins is the perimenopause. So when we talk about perimenopause, we say this is when the hormones start fluctuating. So estrogen levels, rather than being very stable, they will keep going up and down on a day-to-day or a weekly basis. Some days will be good, some days will not be good, some weeks will be good, some weeks will not be good. So there'll be up and down for estrogen, up and down for progesterone, a slow decline in testosterone. Those sort of hormone fluctuations will first start in the perimenopause. That's why we call it perimenopause, because so far there is still hormone production. happening from ovaries. Some hormone is still being produced, but it's gradually becoming less and less and less. And this may take a few months for some women, while it may take 5 or 10 years for some women. So the process can be very long. Perimenopause can happen over a long period of time for some women. For most women, it will be around 2 to 5 years. And that usually happens between 40 to 45 or 45 to 50 when the hormones will start changing. Some symptoms will appear, so hot flashes or night sweats may happen, feeling very hot when the temperature is not so warm or hot, sweating at night, not being able to sleep well, a lot of anxiety, emotional instability, palpitations, low mood, feeling depressed. Then some physical symptoms, for example, lots of joint pains may start, dryness of skin, dryness of vagina, painful intercourse, sometimes lots of urinary infection, bladder problems, and headaches may appear. These are typically what are classical symptoms of perimenopause, which may start during this phase. Then comes menopause. This is when the periods stop completely. So after maybe 2 to 5 years of going through perimenopause, eventually the periods will stop. And this is when we say the woman has gone through menopause. So if the periods have stopped for a year, that's retrospectively we say, okay, menopause has happened now. During perimenopause, remember, the periods will vary a little. So instead of having regular periods may become too frequent. So bleeding may happen every 2 weeks, every 3 weeks, or there'll be long gaps between periods. So there may be one period and then no period for another 2-3 months, then again another period a month later, then again another gap of 2-3 months. It will be all over the place. And then the periods will become less and less and less and stop. So that's when menopause has happened, 1 year of no periods. Anytime from that point on, after having the last period 1 year ago, until the end of life is postmenopause. All that phase, all those years after the menopause has happened, will be termed as postmenopause. So this can be 10, 20, 30, 40 years, a lot of years in terms of postmenopausal phase. And that's why menopause is getting attention, because when we live longer, we want to live healthily, and menopause can take over almost 1/3 or more than 1/3 of a woman's life. And the last 2, 3, 4 decades, we want to make sure we have good bones, good heart, good brain. And so for that reason, to keep the long-term health good, menopause is in focus now, because there are lots of things one can do to make sure that the long-term health is protected. Let's move on to the next step. So when does it happen? When does the menopause happen for majority of women, majority of individuals? We know average age at menopause is about 51. Now this is based on the Western data, like studies in UK or US or Northern Europe. We find that the age is around 51. Most women will hit menopause around 50, 51, but they can have it anytime between 45 to 55. We say somebody has early menopause when they have it between the age of 40 to 45. So if it happens then, and if you go through menopause between 40 to 45, this is early menopause. And that happens to 10% of women, 1 in 10. Early menopause means that the ovaries have stopped producing hormones very early, and there are implications of this on the bone and the heart health later on. What is premature menopause, also called as premature ovarian insufficiency? Now, this affects about 1% of individuals, 1 to 2%, 1 to 2 in 100. And this is when menopause happens below the age of 40. So it happens very early, below the age of 40, even 20s or 30s, one can go through menopause. And that's called premature menopause. It's significant implications for later health. And how much is the prevalence? It varies depending on ethnicity, depending on population, depending on country. In India, for example, some studies have shown that it could be up to 4%, 4 in 100 women. But generally, it's accepted that about 2 in 100 may have premature menopause. There's a lot of variation based on ethnicity. So if you look at Indian studies, the average age of menopause in India is thought to be 46 and a half. So you can see how much difference there is as compared to Western population. It's 51 in the West, while the average is 46 in India. It's 5 years difference, and that's a major difference. So you can see Indian women will have to be even more proactive about their health early on in life, because they're going to likely experience menopause earlier, which will have some impact on their long-term health. So just a quick word about premature menopause or premature ovarian insufficiency. We know it happens to about 2% of women, and sometimes this may be termed as primary ovarian insufficiency or premature ovarian failure. Just bringing up those terms because medical communities or healthcare professionals may use different terms, but they all mean premature menopause. And it can happen for natural reasons, or it can happen due to, say, medical intervention. So somebody has to have a hysterectomy or removal of ovaries early, below 40, then that can cause surgical premature menopause. Somebody may develop cancer and have to have chemotherapy or strong medications, which can also cause premature menopause. And there are lots of guidelines on this condition. So if you're interested, if you would like to know more about it, there are some nice guidelines from British Menopause Society or International Menopause Society, or there is ASHRAE, which is a European society, which have produced some very useful medical guidelines, which can be used both by patients and healthcare professionals. Moving on to why are we talking about these diagnoses? Especially for those with premature or early menopause, it can be potentially life-changing diagnosis. There are a lot of physical impacts of these diagnoses, and of course, emotional consequences, especially those who have early or premature menopause. There can be so much impact on life that they may have to plan for their entire life in terms of this diagnosis. Menopause does cause lack of estrogen. So there are short-term menopausal symptoms that can happen. And everybody is different. For example, some women may have no symptoms at all. They'll be lucky. Some may have very minimal symptoms. But others may have quite significant symptoms. They may keep having hot flashes, keep having night sweat, keep having palpitations, depression. And so everyone is different in terms of what severity of symptoms they experience. Of course, menopause, lack of estrogen will have some impact on bone, on heart, and on cognition. And for those with premature menopause, it can impact their fertility. About 25% of women, even if they have premature menopause, can go on to have some ovarian activity in future. So they may have some periods later on in life. So that's important for the healthcare professionals to know. What causes menopause? Why does menopause happen? Why do periods stop? Of course, we know that menopause will happen once the ovaries stop producing hormones. They're no longer making any active eggs. They're not releasing eggs. No ovulations and no hormone production happens. And once the hormones from the ovaries stop, of course, the periods will stop. Why does premature menopause happen below 40? Again, it's unknown in about 80%. It's thought to be something to do with genes, genetic tendency. In 20%, though, you can find the cause. It may be a genetic cause, something wrong with the genes or chromosomes. It can be an autoimmune condition. There's immunity involved, which fights the ovaries. It can be infections like HIV, mumps, and other infections. It can be metabolic, like galactosemia. It can be some toxins. And of course, chemotherapy, radiation, or surgical removal of ovaries at hysterectomy. All of that can cause premature menopause. If you look at the natural process of how menopause happens, then this figure usually is very useful to explain. So when a woman is born as a baby, she would have almost millions of eggs in her ovaries, 1 to 2 millions. This is at the time of birth. And throughout the life, those eggs in the ovaries will be used. So they're getting destroyed in the background. There are millions and thousands which are getting destroyed. And usually ovulations will happen between the age of 15 to 45, and only about 400 eggs will be actually utilized for the purpose of pregnancy. So every time there is an ovulation. But all those thousands and thousands of eggs keep getting lost in the ovaries in the background. And by 50, around 45, 50, you can see less than 1,000 eggs will be remaining. When that happens, very, very few eggs are left. There'll be no more egg activity, no more hormone production. And that's why menopause happens, when the eggs have run out. With premature menopause, why do eggs run out early, we think it's because of a reduced number of eggs. So women may be born with a reduced number of eggs, so they can't last until 50 and they finish the eggs before the age of 40. Or it could be that the eggs are there, but they get destroyed faster. So the number of eggs at birth may be good, but they get destroyed or accelerated destruction happens. So they finish their eggs very early in life. That's thought to be the reason for premature menopause below 40. What about surgical menopause? So surgical menopause is an entity on its own because it happens when there is hysterectomy with removal of ovaries, or if the ovaries are removed for endometriosis or cancer or any other operation on ovaries. This can be more severe and often not talked about. So women will be told about the surgery, they will have surgery, but not many people get the counseling or advice they need about hormones. And especially if it happens below the age of 45 or 40, it can be very acute and severe menopause. Because remember that whether it's chemotherapy or surgery, the ovaries get damaged quickly. They're either removed with operation, or the chemotherapy can damage ovaries within weeks, more so with alkylating chemotherapy or radiotherapy. And for all these reasons, a woman may be pushed into menopause overnight within 24, 48 hours or within few weeks. And so the symptoms can be quite persistent and severe. How do we diagnose menopause or POI, early menopause? Again, it's the lack of periods. So often the periods will stop, and the bloods are only required if somebody has early or premature menopause. That's under the age of 45. So we don't need any blood tests to diagnose menopause in a woman above the age of 45 if she has stopped periods and she has symptoms of menopause. We don't need any blood tests to start HRT or any other intervention or give lifestyle advice. Blood tests are never going to be useful in perimenopause because they keep fluctuating. Even if I do blood tests on a daily basis, it's not going to be useful. Blood tests are only recommended if someone has early or premature menopause below the age of 45 or 40. And of course, signs symptoms can be lack of estrogen, which we will look in the next slide. Symptoms can be sudden with surgical menopause. That's what we talked about. So what are the implications of somebody going through menopause either naturally after 45, or let's say if somebody has it before 40 or 45 because of surgery or premature menopause? So lack of estrogen with menopause does increase risk of osteoporosis. So anytime estrogen goes down during menopause, it's really important to look after bone, especially women who have early or premature menopause. They really need to have risk evaluation. They need to make sure their lifestyle is bone healthy. For those under the age of 45, HRT is very protective for bone. But even if someone doesn't want to take HRT, then making sure they have enough calcium through diet, that's food calcium, lots of vitamin D. So vitamin D supplement, usually 1,000 units every day, and weight-bearing exercise, brisk walking, running, jogging, weightlifting. Those sort of exercises are very, very important for bone health. And this is applicable whether natural menopause happens after 45 or it's early or surgical menopause. Looking after the bones with exercise, calcium, and vitamin D is really, really important. For those who have very early or premature menopause, we tend to recommend doing a bone scan, but it's not required for everyone if it's a natural menopause after 45. We often say take specialist advice, especially if you already had a fracture because of osteoporosis, or if there is family history of osteoporosis, or you're taking some steroids, then you are more at risk of bone problems. So it's important you see a specialist in that situation. What about heart health? Again, remember, estrogen is a key hormone for women for protecting their heart. So whenever there is menopause, their risk of heart attack goes up. This is for everyone. That's why women often don't have heart attacks until 50, less than men. And then usually after 50, after menopause, they start having the same risk as men after a few years because the estrogen is gone. So they no longer have the protection of their hormones. So it's again important at this point to look at one's lifestyle. If you're going through menopause after 45 or early menopause, making sure you're not smoking, not having excess alcohol, making sure you're looking after your body weight. So eating healthy, exercising regularly, That's very, very important. Because estrogen deficiency otherwise will increase your cholesterol. So many women find that they are having high blood pressure or cholesterol first time when they get to 45, 50. Again, that's because their estrogen is going down with menopause. So their cholesterol, their blood pressure will start rising. Weight gain happens. They start putting on weight because of insulin becoming resistant. All those changes are happening as the menopause sets in. So this is the time to work on lifestyle, weight, diet, exercise, and making sure you get good enough sleep. So sleep and stress reduction is equally important. A lot of us are now often carry technologies, phones, TV at the time of sleep. That may not be very good for our sleep. It's important to give a break on the phones or TV at least 40-45 minutes before going to sleep, because it will not disrupt your sleep, and sleep is very important for heart health. For those who have early premature menopause below 45, HRT helps because it lowers the risk of heart disease, and it's recommended at least until 50. What about dementia, cognitive health? So again, if you have an early menopause below the age of 45, then it does increase your risk of dementia in future, and HRT will be very useful to reduce that risk. But if you have a natural menopause, say after the age of 45, then it's not necessary that you have to have HRT, because we don't know whether HRT protects against dementia. Just the lifestyle, healthy diet, exercise is more crucial after the age of 45. For those who have, say, early menopause or premature menopause below 40, they sometimes question about fertility. If they've not had children yet, what happens? There is a possibility that if you don't have any cause for early menopause, you might still have 5 to 10% chance of a natural pregnancy, but HRT is not contraceptive. And for those who don't have that chance, egg donation, IVF, is what we recommend for fertility. I'm not going to talk too much details about this, but if someone is interested, do ask me a question specifically. So symptoms and quality of life, and then we'll finish with that. So what sort of symptoms to expect in menopause? More than 80% of women will have some or other symptoms of menopause. And about 30% of more can have severe symptoms, quite debilitating symptoms, which affect the quality of life and the workplace life. So the common ones are irregular bleeding, that usually happens in perimenopause. Hot flushes, warm sensation around the face, chest, arms, and then the extremities. Sweating at night, disturbed sleep. These are again typical symptoms. Dry hair, dryness of eyes, dryness of skin and mouth, these can be typical. Very low energy, feeling very tired, low libido, less interest in sex, body joint pains all over the body are again symptoms that can happen. Some women only report emotional symptoms. For example, a very labile mood, mood goes up and down, irritability, heightened anxiety, feeling palpitations. This can be the only symptoms for some women. Brain fogging, poor concentration, memory loss, not being able to remember something that you would previously remember easily. And of course, some local symptoms like vaginal dryness or painful sex or bladder symptoms. These are local symptoms because of lack of hormones or lack of estrogen. Psychological support is important. There are lots of now charities in UK, for example, who do provide psychological support, specialist care for women, especially who have early or premature menopause. And so if you need help, don't stay back. If you feel psychologically, emotionally affected by menopause, remember there is help out there. I'm sure there'll be lots of charities supports available or growing now in India, including what Sharmila is doing in her own sort of group. So seek help, seek counseling, because there is lots you can do with life planning and making sure you have somebody looking after you during your menopause. And in summary, therefore, you have early and surgical menopause where you need a lot of input from specialists, both medical and psychological teams. Early diagnosis, quick referral is important, especially for somebody having a surgical menopause, because often these things are not discussed at the time of hysterectomy or removal of ovaries. And often after the operation, very little help is provided in terms of menopause or hormones. Lifestyle, that's the key. Whether you have a natural menopause or induced menopause, lifestyle is key. Looking after your bones, looking after your heart, looking after your brain, those are really, really key. Whether you choose to take HRT or not is different. It's everybody has their different decision. There are many non-HRT, HRT treatment options. If you have lots of symptoms, you don't have to suffer in silence. I haven't touched upon HRT today because that will be too much in one go, but there are lots of things you can consider for symptom control. And of course, we need to understand more. So as we know more about these things, we're trying to do lots of research, especially in settings like, say, Southeast Asian women or Afro-Caribbean women. We understand very little about menopause in these women. Lots of studies have happened in Western population, but hopefully we are studying more in Asian women or Southeast Asian women about how menopause progresses, what is the impact on bones and heart. So as research continues, we'll hopefully be able to offer better solutions in future. So that's in a summary how perimenopause, menopause, premature menopause is defined and what are the important implications for future health. So thank you for joining. I'll stop there with my slides and a bit of background information. You're free to ask questions or share your experience. More than happy to discuss. Thank you.
Thank you, Vikram, for such a wonderful session. And especially, I always wanted to, let them know that there are some silent things, silent diseases like bone health, osteoporosis, and
Yes.
cardiac, which is not being spoken about. That is really wonderful that you covered it up, and that is what I was trying to, mention as well. It's not about just the symptoms; it's about what follows postmenopausal as well. Yeah, so that's very lovely. So, thank you.
Thank you.
Why don't thank you for all your support and the love, and the floor is open for questions. You can go ahead.